There's two main ways that we take care of aortic stenosis. Until about 10 years ago, the only way to treat aortic stenosis was with surgical aortic valve replacement. That involves an incision and the heart-lung machine, and still is the right treatment for a subset of patients. But over the past 10 or 12 years, we've done a lot of innovation and really rigorous clinical trials that has yielded a new, less invasive technology that's a good treatment for a majority of patients with aortic stenosis. That's called the transcatheter aortic valve. And for appropriately selected patients, the aortic stenosis can be relieved with a catheter, big catheter, and a stent valve as opposed to open surgery. A really, really important part of the whole, evaluation and treatment planning is being cared for a multidisciplinary team that has expertise in the whole variety of treatment options and really great experience and understanding in matching a person's particular clinical circumstance, their clinical anatomy, with the best treatment for them. The outcomes for transcatheter valve and surgical aortic valve are really quite similar and great, particularly when matched to the right patient population. We work really hard to make it as smooth a patient experience as we can, starting with education on the phone or even with a video visit if desired, before the patient ever comes to the hospital to be seen and to have the evaluation start. It can be a complicated process, and it involves a really highly dedicated and super specialized multidisciplinary team to evaluate these patients. We work really hard to keep the flow of information both between ourselves and the patient and often their home care provider who may not necessarily be an integral part of the team at Allegheny Health Network. We try and make sure that flow of information and communication is great. We work really hard to minimize unnecessary trips into the city or trips to the hospital and make each visit as efficient and effective as possible.